Well, let's get more on our top story now. More than 2,800 operations have been cancelled as junior medics go on strike for a second time over their new contracts. The major sticking point between them and the government is whether they should receive overtime pay for working Saturdays. Well, some of the medics have taken to social media to explain what they bring to the NHS. So should junior doctors be allowed to strike, and is enough being done to negotiate a deal on their new contracts? Well, joining me now to discuss that, junior Doctor Reena Aggarwal, who's a registrar in obstetrics and gynaecology, and Roger Goss from the group Patient Concern. Thank you both very much for joining us this morning. Dr. Reena Aggarwal first, what for you is the main sticking point as far as you're concerned?
The main concern for 54,000 junior doctors is the fact that we think this contract is not safe for patients. That is the main problem. It is not about pay.
In what way is it not safe?
The government suggests increasing the number of doctors on Saturdays and Sundays. I don't think there's a single junior doctor that would not wish to have good services over the weekend, but it is exactly the same number of doctors that you would have, that you would extend this service. So there are two ways of doing this. Either you make junior doctors work longer for less, or you stretch the service where we are already stretched from Monday to Friday. Neither of these options are safe for patients, and this is the reason that 54,000 junior doctors are so upset, angry and demoralised with the current rhetoric from the government.
OK. Roger Goss from Patient Concern, you've heard what Dr Aggarwal said there. It's about tiredness, it's about stretching doctors, it's about patient safety.
Yes, well, it's a very sad situation. Let's put the emotional rhetoric to one side and remind ourselves of the facts. If you go into hospital on a Sunday rather than a weekday, you're more likely to die than if you're in on a weekday. It's about 30% higher chance of not surviving. Now, the BMA has said, well, this is misinformation. But of course, you only need to count the number of death certificates at hospitals to confirm that that is true. So they then react by saying, well, of course, it's inevitable. People are not going to go into hospital on Sunday unless they're more seriously ill. To which the answer is, well, in that case, why do so many hospitals have half the number of doctors on duty that they do weekdays, or even only a third? Surely if they get more serious cases on Sunday, they should have more doctors, not fewer.
OK, Roger, let's just pause you there. Dr Aggarwal, I mean, what on that point? I mean, do you accept that the NHS does need change? You heard what Roger Goss was saying there. We've had a lot of emails into us this morning. One from Catherine in Hertfordshire. She took her mum to A&E at the weekend with stroke and chest infection. During the weekend, she couldn't get any doctors to look at her chest. Throughout the weekend, she was told, the trouble is it's a Saturday, the trouble is it's a Sunday, then the trouble is a Monday, by which time she says she was livid and told them is enough. She believes on this basis the NHS only works 4 days, assuming it's Tuesday, Wednesday, Thursday and Friday. Some would say that Friday is also unpredictable. There are people who do feel that they don't get the treatment that they should have at the weekend, aren't there?
And I think you're right. And I think the data that the government are putting out about there being extra deaths over the weekend is misrepresented. Even the author, Nicholas Fremantle, says that to say that these deaths would be avoidable or to attribute them to the number of junior doctors that are on the floor would be rash and misleading. To go back to your point about what your person who's here has said, and also the person who's written in, absolutely we need to have better services on the weekend. But I will give you an analogy. A pilot who flies on a Sunday or on a Saturday has exactly the same level of ground staff that he has on Monday or Tuesday. The NHS is not like that. on Saturdays and Sundays, we deliver an emergency service exactly as we do on Monday to Friday. We don't have the same level of ground staff. That requires your diagnostics, your clerical staff. And so that is what, when people are saying the trouble is it's a Saturday or the trouble is it's a Sunday, is because we don't actually have the diagnostics or the support staff necessary always to have the same care. You have exactly the same number of doctors on the floor Monday to Sunday delivering emergency care.
OK, that's a fair point, isn't it, Roger Goss? Junior doctors do already work weekends. It's just everybody else in the hospital that doesn't. It's the people, as you said, providing the backup stuff, the ground care.
Some doctors work at weekends, but we've had a lot of experience over the last few weeks being in hospitals at weekends. And actually, the situation is very depressing. One of the worst things, a point that hasn't been made up till now, is that if you're expecting to be discharged and you don't get it organised on a Friday, then you're stuck there until Monday because there's no doctor available to authorise your discharge.
Isn't that more about, sorry to interrupt, Mr. Goss, but isn't that more about consultants than junior doctors? Isn't that more about the consultants not being there at the weekend?
So I think there's 2 points there. So the fact...
Sorry, Dr. Aggarwal, just let Mr. Goss reply.
No, the doctors who were in charge of patients we've seen at that time were not available to take the decisions that were necessary as to whether they should be discharged. And the other point I do want to make, I don't know how deaths at weekends can be presented misleadingly. It's a matter of fact. You only have to count the number of death certificates to know that you would be very unwise and very foolish to go into hospital on Sunday if you can possibly avoid it. And that is not simply because things like the laboratories and other services are scaled down. It's also because there are far fewer doctors. Yes, there are some, but there are far fewer.
OK, Dr. Aggarwal?
Can I come back to that? Please come to the hospital if you are unwell on the weekend. You will get full emergency care. There is exactly the same number of junior doctors and there is senior clinical decision makers there. This is exactly the misinformation that is being sent out into the public as a result of the rhetoric from the government. In terms of who makes the decision, the reasons that we may have less good care on the weekend is partly because of the ground staff that are not available. So the fact that you can't get your discharge done is because pharmacy may not be open, or potentially you don't have the senior clinical decision makers on the floor. However, in my specialty in obstetrics and gynecology, that is very different. And I know across the hospital, the consultants are in on the weekends making the senior clinical decisions that are necessary to discharge patients. Going back to the data regarding people are more likely to die if they're admitted onto the weekend, actually the data shows that if you're admitted over a weekend, you're more likely to die on a Wednesday and within 30 days of your admission. So it's got nothing to do with the weekend. We need to look at why patients are coming in on the weekend more sick. Is it because the community services are not strong enough? Is it because we haven't got good GP services? David Cameron talks about wanting 5,000 extra GPs by 2020. The problem is we have a recruitment and retention crisis in general practice. In the recent recruitment crisis, GP applications are down. 1 in 2 junior doctors year 2 of being a doctor are leaving the country. There is a massive problem in terms of recruitment and retention. If you stretch the already stretched workforce, you are going to cause huge problems for patient safety.
OK, Dr. Aggarwal, just let you pause there because I know that Roger Goss wanted to come in on one of your points and I also want to put the point to him about retention of staff. What were you hoping to say there, Mr. Goss?
Well, I think it's a very poor argument to say that because some of the other services are scaled back or not open on Sunday, therefore doctors shouldn't be in there either. Surely the argument should be that all services should be open on a Saturday and Sunday. It's a miracle in my eyes how the medical profession managed to establish a situation where it did not treat the provision of healthcare as a 24/7 activity. If you want to sign up and become a commercial airline pilot, if you said, well, I don't fancy working weekends, they'd laugh at you. It's quite ridiculous.
OK, let me just put the point to you that Dr Aggarwal was making about staff and retention. You speak for patient concern, you're speaking on behalf of patients, but in terms of public support, 66% of the population still do support the doctors, and a lot of the emails we've had today have been supportive. One saying they support them with all their heart. How can it be OK to pay unqualified MPs what they pay compared to what junior doctors get paid? And another, who's a GP in central London, has a number of junior doctor patients, says their rights are being eroded. They will leave in hordes. The public will look back and regret, alienate doctors at your own peril, and before you know it, you have an American system. Junior doctors are leaving the country in large numbers, aren't they?
I don't know. I don't have the figures. We're told this, but whether it's true or not, I don't know. And the point I would come back to is the reason the public are so sympathetic is if there's a choice between doctors and politicians, obviously the public are going to side with doctors because they are wonderful people and they do a wonderful job. But you see, the doctor you have on even denies the physical facts of deaths, saying that in fact more people die if they go in on a Wednesday than if they go in on a Sunday. Well, surely we need to nail the facts to the ground, and one of the reasons the public is so supportive of the doctors is the facts that have given rise to this sad situation have been obscured in all the rhetoric.
OK, I'm afraid we are going to have to leave it there. Roger Goss from Patient Concern, Dr Reena Aggarwal, thanks very much for coming in and talking about it. The strike continues today. Will there be a third one? We shall have to see.